Hi, welcome to IU General Surgery. I'm so glad you're able to join us for interviews. I hope that this video will help you understand a little bit about the highlights of our clinical environment here at IU. We have a breadth of clinical experiences, and I'm only going to touch on a few of them. As I stated, my name is Jennifer Choi. I actually trained in this program, so I have seen this institution grow its clinical programs, grow in its faculty size, grow in its residency size, but really maintain the heart of who we are. And that is a really caring and generous group of surgeons who really want to train a great generation of clinical residents. So thank you so much for being here. I hope that this video will help you better understand our institution. Now, I am only going to get to go through a few highlights. I won't touch on every institution that you will rotate at, but rest assured that each institution will add value to your training. First, I want to talk about Eskenazi. So Eskenazi is our Marion County Hospital. It is a facility that is very important to the county. It is a level 1 trauma center. We have 1,600 trauma admissions each year, and an unusual number of those are actually penetrating trauma. So while as a resident, this is really good news. That means you'll get great operative experience. It also means that there are issues of violence in the city. Now, I would consider Indianapolis a very safe city. But again, there are pockets of violence in different places. We do have a program called Prescription for Hope. And this is a really important program that our surgeons are very engaged in to help our trauma patients recover from their traumatic injuries, reintegrate into society, navigate employment, the justice system, and other social services in an effort to help prevent traumatic injury recidivism. We've had dramatic decreases in our re-injury rate from up to 30% at its height to now 4%. And so this program has been really important with that. Again, as a surgeon, the operative trauma is exciting, but as we all know, violence is an increasing problem in our society, and I'm really happy that we're involved in helping find solutions to that problem. Right down the street from Eskenazi is our VA Medical Center. Now, the VA I want to highlight because it's not always the place where you might think of cutting edge surgery, but the VA is really where our robotics program really got its start. So our robotics and general surgery are throughout all of our facilities. We have general surgeons teaching and doing robotics every single day, a whole variety of patients. But again, the VA was really among the first, and so I want to give them huge kudos for stepping out into this space early in the robotics era. Next is University Hospital. University Hospital is a quaternary care hospital. Now, admittedly, in the future, we're going to put our University Hospital combined with our Methodist Hospital. That will happen during the time that you are training here. But University Hospital by itself really focuses on cancer care as well as transplant. Those are two big foci of clinical care that we have. We also do all the other kinds of general surgery here, including hernia and foregut, many other types of operations. But I do want to highlight cancer care. Most people don't think of IU potentially as being a pancreatic cancer or pancreatic surgery mecca, but you will find that we do more pancreatic surgery here than any other institution in the United States. As a resident, this is really good for you. Again, really great operative experience. And also, there's only one fellow, so not a lot of competition for cases. Methodist Hospital, as I mentioned, will eventually combine with University Hospital. Methodist is another level 1 trauma center. It's actually only about a mile from Eskenazi Hospital, but this is a statewide level 1 trauma center. They do take care of many patients from the Indianapolis area, but also get referrals from around the state. Our level 1 trauma center at Methodist also cares for our IndyCar drivers. So come the month of May, you'll notice a bit of a change in some of the clientele that we have at Methodist Hospital. We are a statewide referral center for acute care surgery. So again, many patients from all around the state seek care at Methodist Hospital, where we again provide a breadth of care for all of those patients and have a really robust surgery critical care service to also assist in that care. So Methodist Hospital is busy day and night. They are operating day and night. Great experience, again, from the resident perspective, from a clinical work standpoint, as well as from a teaching standpoint. Riley Children's Hospital. So Riley is near and dear to my heart. This has been a really important piece. When I was a trainee, our chair was a pediatric surgeon. And again, Riley Hospital has grown and developed over time. They are a top 10 U.S. News children's hospital. So they have been recognized for their excellence in care in all aspects of care of the pediatric patient. There are many pediatric hospitals that have difficulties having a full spectrum of index cases for pediatric surgery. And again, Riley does not have any shortage of that. And you will see many of those things that you thought you'd ever only read about, but you'll see them almost every day at Riley. So again, a great opportunity to experience the clinical care given to our children of Indiana at Riley Children's Health. The last place I'm going to focus on, and the last place I'm going to highlight, is Moi Teaching and Referral Hospital. So this is a global health experience in Eldoret, Kenya. IU actually leads an organization called AMPATH, which is an organization that has developed partnerships all over the United States to bring excellent care and even global health research to the global health community. We're currently based in Eldoret, Kenya, with the intent of opening a few more sites for AMPATH over the next several years. IU does have a surgeon present at Moi University at all times, which enables us to have an ACGME accredited rotation at Moi for our residents to take part in. As you know, this is not a really common experience, but this is a great opportunity for any of you who are interested in the global health space or just educating yourself about global surgery. I think this is extremely important. And again, something as a resident I was able to take advantage of. And so one that I really encourage any of you to take advantage of if at all possible. So that's a really short tour. I personally work at IU Health North. We do our MIS and bariatric surgery there. IU Health West is a community general surgery environment. And again, I think that is an extremely important addition to our program. Our residents have been there for many years and really find that a valuable operative experience. I think the combination of all of our clinical experiences make our program uniquely situated to prepare you to go into general surgery straight out of residency or to enter a fellowship of whichever type you want. So I think, again, hopefully you'll see that IU is a great program. We really encourage your growth really from an early stage. And again, I hope you've gotten a glimpse of the clinical experiences at IU through this presentation. Thank you so much.